everyone, this is Dr. Shweta Patel from Horizon West, OBGYN, and today I wanted to have a very open discussion about one of the most common questions I've been receiving recently, and that is, should I get the COVID vaccine if I'm pregnant? And to kind of bring some more information about the importance that this topic specifically carries for pregnant moms, but not only just pregnant moms, but also for expecting mothers or moms who are trying to become pregnant, or even moms who are already delivered and breastfeeding. This information really applies to all of these women. So to start out, I think it's really important to understand that how vaccines work, and that may at least somewhat reduce fears of how dangerous a vaccine might be, or whether it's a safe tool to use to protect yourself from a very dangerous illness. So there's typically three ways a vaccine works, and understanding that can sometimes shed light on how safe the COVID vaccine actually is. So the first way a vaccine can work is it can be the actual virus itself, but it has been weakened. So think of it as kind of like a beaten up version of the virus that we are trying to develop immunity to. And you are given essentially like an appetizer form of it so that your body kind of gets a feel of what things taste like. And then you don't need to necessarily have the entire main course in order to recognize whether this is something you've seen before. And that's the premise of how a vaccine essentially works. It is a actively given vehicle of the viral information, and your body has a controlled opportunity to develop an understanding of this and to then develop a defense strategy. That's our immune system. And by doing that, it then can detect the virus when it presents itself to your body under the setting of an actual infection. And your body can then fight it off as opposed to having no clue what just hit it. The second way a vaccine can be used is if it is not the actual virus or bacteria itself, but it is particles of it. So instead of using the entire structure of a virus or bacteria, there are certain vaccines that only use the outer coat of the vaccine, of the virus or bacteria. And that is sufficient enough for your body to recognize, this looks kind of like that outer coat that I remember seeing 2 months ago, and I'm going to now respond to it the same way as I did back then. And that would be the purpose of how the vaccine would work in that setting. And then the third way would be to actually have the vaccine carry information into your body and have your body produce that information that it can then develop an immunity to. And this is where the COVID vaccine comes into play. It is not a weakened version of COVID. It is not parts of COVID. It is actually using it's actually using a virus that's not COVID to carry COVID information into our cells. And then our cells are used like a factory to produce COVID-like particles on the surface that then your body is like, whoa, this doesn't look normal. Never seen this before. We need to develop a strategy and respond. And so that's how our current day vaccines for COVID work. That is what an mRNA type of vaccine, how the actual, mechanism of it is. And so it's a little, you have to admit, it's kind of sneaky the way they manage to do that, because you're not actually using anything active or even inactive of the COVID virus. That's also the reason why that's really important to understand, is because that is what makes it so safe, particularly in a population that we consider to be delicate, such as a pregnant mom. And also why we now as OBGYNs are thoroughly standing behind it. Now, I'll have to admit, I definitely believe in vaccines. I have gotten all of my immunizations from as long as I can remember, crying and hating getting them. But I am a believer in science, and I believe in making, information available, which is why I do these lives. And I feel very strongly that when there's data supporting something, you should utilize the tools you have available to you. That's how we've eradicated smallpox. That's how we have avoided having chickenpox on the level that when I was a child, it was so prevalent, and now you rarely see it. And that's how we are hopefully one day going to eradicate cervical cancer with the HPV vaccines. See, I did a little plug in there for that one. Get your HPV vaccine. It's okay now for up to age 45 in women. Side note. But this is why the COVID vaccine is very safe in pregnant women, in women who are trying to get pregnant, and women who have already delivered and are breastfeeding. In fact, there are studies supporting that a mom who has gotten the vaccine and has already developed antibodies to COVID can pass them through the placenta, thus allowing the unborn fetus to have its own protection. Now, we're still kind of figuring out how protective that immunity will be. It's all a concentrations game. And the reason why that's important is because if you have, it's like having an ingredient. You can have salt in your house, but if you don't have enough salt in your house, it's not going to make the dinner you're trying to make. Same goes for our antibodies. We can have antibodies to something, but if we don't have an enough amount of antibodies to something, our body may still not be able to mount the response we want it to. And therefore, it doesn't serve as being an effective way to protect yourself. So right now, though we know that it is the antibodies to COVID do and have been found to be present in umbilical cord samples and thus in the blood of the born baby. We don't know necessarily, and this could be something that I'm not up to date on just yet, whether this is protective to the baby, but we do know that it does cross over, and it definitely, having the antibodies is not harmful to the newborn. Hopefully it would be protective. Now, going back to, is this something that's safe? Do we know enough about it? Scientifically, theoretically, this is considered to be safe science. The logic behind how this vaccine was created is actually very safe. There's always the element of what don't we know that we don't even know, right? And I can understand the consternation that comes with something like that, especially because of something as sensitive as pregnancy and wanting to be protective not of just of yourself, but of your unborn child and or your newborn. And that's a valid concern. I personally also was hesitant when the vaccine first came out, despite all of my education and my openness to science and vaccines and being a huge supporter of everything that is evidence-based medicine. And you can ask my colleagues, I was hesitant because we just didn't have enough time or data. And recently, now that I'm vaccinated, recently it occurred to me, what if it's not that this vaccine was rolled out quickly and therefore it must be unsafe, or we don't know if it's fully safe. What if we're just used to vaccines taking all these years to be vetted and proven to be secure, and we've gotten used to this because we think that's how we are confirming that they're safe. But maybe that was the inefficient process. And maybe now when, our back was up against the wall in face of a pandemic, perhaps the FDA, the CDC, they all rolled this out as quickly as they did because this is something that maybe could be done on this timeline, just hadn't been done before. Regardless, and we can get into this, and hopefully we won't, regardless of whether you stand by the safety of it or not, whether you agree with it or not, whether you feel like it's appropriate to be mandated to get it or not, those are not the issues or the questions or even the opinions I'm trying to bring to this live. My main goal is to abate some of these fears that my patients particularly have had, and are keeping them from getting a vaccine that is proven to work to help develop antibodies. And there's nothing more than that simple fact. When you get the vaccine, most people who get it develop antibodies. And if you have antibodies to something, you are more equipped to protect yourself and fight off this virus than if you don't have antibodies. In fact, some people use that as their justification for not getting the vaccine. Some consider that if they've had the virus, they've suffered from COVID, and they have developed an immunity naturally, then do they even need the vaccine? And that's a great question. Also something that's being more and more studied. But if you do know that you have antibodies, whether it's naturally or whether it's from having gotten the vaccine, yes, you are in a better position to fight off COVID than if you did not have antibodies. But the premise of feeling like you don't need to get the vaccine because you've had COVID, that is a little too broad to be 100% confident on without actually knowing more information. What I mean by that is, if you want to actually see whether you need to have the vaccine because you are presuming that you have a natural immunity, go get your antibodies tested. See if you actually do. And then the other element of it is that this immunity is not lifelong. Having had COVID once doesn't actually protect you for the rest of your life from that COVID. And we also have this other COVID called the Delta variant, which is seemingly a lot more virulent than the original strain. So all in all, it would be beneficial to utilize the tool that we have. Of course, everyone has their concerns and their hesitations. I did too. And ever since I was able to, kind of get more into the information of how this vaccine was designed and how it benefits pregnant women and how it might benefit the newborn, and how the science behind it is set up so that it is a sneaky little vaccine that allows for information to get into our body and then allow our body to actually develop a defense with this information without having to be exposed to a weaker version of the virus or any of the viral particles. That's kind of brilliant. And as far as how safe are vaccines in general, I'm not even gonna go there because vaccines have proven to be safe in the past. So if you don't believe in them, that is totally your right to think that way. But for everyone else who may be tuning in or who may be wondering whether this is a good idea, and particularly my pregnant moms of our local community, I do hope that you reconsider, or if you're having hesitations, please reach out to your OBGYN, have that honest discussion, ask them the questions you may have that's making you think that maybe this might not be a good choice for you. And then, just look at the data and make your decision according to that. And hopefully this was helpful to you. If you have any questions about the vaccine itself, I thoroughly encourage you to reach out to me. I would be happy to explain it. I'll even use my whiteboard. Otherwise, I wish everybody a safe weekend, and thanks for tuning in. Have a good one.